Well, hello there, everyone. I'm Dr. Deborah Wilson, and today I want to talk about something that comes up very often in conversations with older adults and their families, and that is memory loss. This is one of the most common concerns I hear in clinic. Someone will say, I feel like my memory isn't what it used to be. Or a daughter or son will quietly ask, I'm worried about my mom. She keeps repeating herself. Memory changes can feel frightening, and sometimes people immediately jump to the worst case scenario. So, today, I'd like to walk you through this topic carefully and calmly. We're going to talk about what memory loss really means, what is considered normal aging and what is not, common causes of memory problems in older adults, early warning signs that should prompt medical evaluation, how doctors assess memory changes, and finally, what you can do to protect and support brain health as you age. First, let's clarify what we mean by memory loss. Memory loss simply refers to difficulty recalling information that you previously would have remembered more easily. But here's something very important. Not all memory changes are abnormal. As we get older, certain cognitive changes are expected. It may take longer to recall a name. You might walk into a room and forget why you went there. You may misplace your glasses more often. You might struggle briefly to find the right word during conversation. These experiences can be frustrating, but they are often part of normal cognitive aging. The brain processes information more slowly as we age. Retrieval speed decreases. Multitasking becomes harder. However, this is very different from the kind of memory loss that interferes with daily life. The key question we ask is, does the memory problem affect independence? If someone occasionally forgets a name but remembers it later, that is usually normal. If someone forgets how to pay bills, gets lost in familiar places, or cannot manage medications safely, that suggests something more serious. To better understand this, it helps to know how memory works. Memory is not a single function. It involves multiple steps. First, you must pay attention. If you are distracted, stressed, or multitasking, you may not properly encode information in the first place. Then the brain encodes the information and stores it. Later, you retrieve it. As we age, attention and processing speed decline somewhat. That means sometimes what feels like forgetting is actually a problem with attention at the start. For example, if you put your keys down while thinking about something else, your brain may not fully register where you place them. Later, it feels like a memory failure, but in reality, the information was never clearly stored. In normal aging, retrieval may be slower, but the memory is often still there. In contrast, in conditions like Alzheimer's disease, the brain has difficulty forming new memories at all. So, why are older adults at higher risk for memory problems? There are several reasons. Structurally, certain parts of the brain, particularly the hippocampus, which is essential for forming new memories, gradually shrink with age. Blood flow to the brain may decrease over time. Small blood vessels can become damaged, especially in people with high blood pressure or diabetes. Cardiovascular health plays a major role in brain health. Conditions like hypertension, high cholesterol, diabetes, heart disease, and stroke all affect the blood vessels that supply the brain. Over years, this can impair cognitive function. This is why we often say that what's good for the heart is good for the brain. Medications are another important factor. Many commonly prescribed drugs can affect memory, particularly in older adults. Sedatives, sleeping pills, certain bladder medications, antihistamines, opioid pain medications, and drugs with anticholinergic properties can all cause confusion or memory impairment. As we age, our bodies process medications differently. The liver and kidneys may clear drugs more slowly, and the brain becomes more sensitive to side effects. Whenever memory concerns arise, reviewing medications carefully is essential. Mood disorders also play a significant role. Depression in older adults often does not look like sadness. Instead, it may present as low motivation, poor concentration, slowed thinking, and memory complaints. Sometimes people with depression are deeply concerned about their memory, yet cognitive testing reveals that the underlying issue is mood related. This is sometimes called pseudodementia. The encouraging part is that when depression is treated, cognitive symptoms often improve. Sleep is another critical factor. During deep sleep, the brain consolidates memories from the day. Chronic sleep deprivation or untreated sleep apnea can significantly impair memory and concentration. Social isolation also increases risk. Humans are wired for connection, and regular conversation and interaction stimulate multiple cognitive pathways. When evaluating memory loss, it is helpful to separate causes into reversible and progressive categories. Reversible causes are especially important because identifying and treating them may improve symptoms. These include vitamin B12 deficiency, thyroid disorders, medication side effects, depression, sleep disorders, dehydration, infections, electrolyte imbalances, and excessive alcohol use. For example, urinary tract infections in older adults can sometimes present primarily as confusion rather than typical urinary symptoms. This is why a thorough medical evaluation is important before assuming dementia. On the other hand, there are progressive causes of memory decline. Mild cognitive impairment, or MCI, falls between normal aging and dementia. Individuals with MCI have noticeable memory changes and measurable decline on cognitive testing, but they can still function independently in daily life. Some people with MCI remain stable for years. Some even improve, especially if underlying causes are addressed. Others may progress to dementia. Dementia itself is not a single disease, but a syndrome, meaning a group of symptoms characterized by cognitive decline severe enough to interfere with daily functioning. Alzheimer's disease is the most common cause, but there are others, including vascular dementia, Lewy body dementia, and frontotemporal dementia. So, how do you know when memory changes should prompt medical evaluation? Warning signs include repeatedly asking the same questions, getting lost in familiar places, difficulty managing finances, missing appointments frequently, trouble following recipes or multi-step instructions, noticeable personality changes, increased irritability, apathy, or poor judgment. Another significant red flag is when family members notice changes more than the individual does. Loss of insight can occur in early dementia, meaning the person may not recognize the extent of their own cognitive decline. When someone comes in for evaluation, the process typically begins with a detailed history. When did symptoms start? Have they progressed gradually or suddenly? Were there any recent illnesses or medication changes? Has there been a head injury? We also assess daily functioning. Can the person manage finances, drive safely, prepare meals, handle medications? Cognitive screening tests are often performed. These brief assessments evaluate orientation, short-term memory, attention, language, and executive function. They are screening tools and do not provide a definitive diagnosis on their own, but they offer valuable information. Laboratory testing is usually ordered to check thyroid function, vitamin B12 levels, electrolytes, kidney and liver function, and blood sugar. Brain imaging, such as an MRI or CT scan, may be recommended to evaluate for stroke, tumors, hydrocephalus, or structural changes. The goal is to identify potentially treatable causes and to clarify whether a progressive condition is present. If memory loss is left unaddressed, reversible conditions may worsen unnecessarily. If the cause is progressive dementia, early diagnosis allows for better planning. Families can discuss financial arrangements, advance directives, safety modifications, and support services. There are medications that may modestly slow progression in some forms of dementia, and early intervention can improve quality of life. Delaying evaluation often delays support and planning, which can create additional stress later. If you notice memory changes in yourself or a loved one, start by assessing the severity. Are these occasional lapses that do not interfere with daily functioning? Or are they consistent problems that affect independence? If the changes are mild, focus on lifestyle factors. Improve sleep, increase physical activity, engage in mentally stimulating activities. Review medications with your healthcare provider. If the changes are concerning or progressive, schedule a medical evaluation. Bring a family member who can provide additional perspective. Document specific examples of memory lapses, as this helps clinicians tremendously. Now let's talk about prevention and brain health. While there is no guaranteed way to prevent dementia, research suggests that we can reduce risk. Managing cardiovascular health is one of the most important strategies. Control blood pressure, manage diabetes, treat high cholesterol, exercise regularly. Physical activity increases blood flow to the brain and stimulates growth factors that support neuronal health. Aim for about 150 minutes of moderate exercise per week if possible. Even walking consistently can make a difference. Mental stimulation is also protective. Lifelong learning strengthens neural connections. Read regularly. Learn a new language. Take up a musical instrument. Engage in strategy games. Challenge your brain in new ways. Social engagement is equally important. Stay connected with friends and family. Join community groups. Volunteer. Conversations stimulate memory networks and executive function. Nutrition plays a role as well. A Mediterranean style diet rich in vegetables, fruits, whole grains, healthy fats, and fish has been associated with lower dementia risk. Limiting processed foods and added sugars is beneficial. Sleep should not be overlooked. Aim for 7 to 8 hours of quality sleep per night. If you snore heavily or feel excessively sleepy during the day, consider evaluation for sleep apnea. Limiting alcohol intake is also important, as excessive alcohol can accelerate cognitive decline. Finally, address hearing loss. Untreated hearing impairment has been linked to increased dementia risk, possibly because it reduces cognitive stimulation and increases social isolation. Hearing aids, when appropriate, may help preserve cognitive function. Memory loss is one of the most feared aspects of aging, but fear alone does not help us. Knowledge does. Many causes of memory problems are treatable, many risk factors are modifiable. Early evaluation allows for clarity, support, and planning. Not every forgotten name is a sign of dementia, but persistent progressive changes deserve attention. To summarize, memory changes exist on a spectrum from normal aging to mild cognitive impairment to dementia. Warning signs include repetition, disorientation, and functional decline. Evaluation typically includes history, cognitive testing, laboratory work, and sometimes imaging. Prevention focuses on heart health, exercise, mental stimulation, social engagement, sleep, and overall wellness. If you are concerned about memory changes, do not ignore them. Seek evaluation. Early action makes a meaningful difference. Thank you so much for spending this time with me today. If you found this discussion helpful, I hope you'll continue learning and staying proactive about your health. I look forward to seeing you again in the next episode.